Oh,
Sorry, I'm going to
good
be on
morning.
mute.
Good morning.
Yes.
Good morning. Sorry,
Yeah.
I'm in transit, so
Thank
I
you.
apologize. So I'm going to
That's
I'll be on my on camera, but off mic.
Okay.
Yeah.
Good.
Thank you so
Good
much.
morning.
Good morning.
Is it better?
Yeah, actually, it's a night in the Korea. Nice to meet you.
Nice meeting you too.
Yes.
Okay.
Yes. We are very great honor for us for invite our teams in a great meetings. We are so totally deeply gratitude to inviting our team in a great meeting. So could we invite our teams to you very shortly? Is that okay?
Sure.
Present-
Definitely. Yeah. Just confirm that you are able to hear us clearly, and then what we will do, we will start by introducing ourselves, and
Yeah.
then look forward to hear about your team and you.
Okay.
Okay. Perfect.
Thank you.
Dr. Boston, would you like to just to introduce yourself, since you will be departing soon? You want to play?
Yeah, sure. So, Dr. Matthias Bostrom, I'm the Associate Surgeon Chief at the Hospital for Special Surgery, and the sort of physician lead for our global efforts. So, I've been to South Korea multiple times. Look forward to your presentation.
Wonderful. Dr. Schroeder?
Morning, everyone. My name is Jim Schroeder. I'm the new Chief Academic Officer here at HSS, and I'm looking forward to working with Dr. Bostrom on these efforts. I've been to Seoul several times, and looking forward to hearing about your work.
Wonderful. Thank you. And my name is Alia Nadik, and I am the Director of Continuing Professional Development and Education at Hospital for Special Surgery. I oversee our portfolio of accredited continuing education for physicians as well as interprofessional teams. I also oversee the global partnerships and academic visits program. Jane?
Good morning. My name is Jen. I'm the Senior Manager of Global Partnerships at HSS. I oversee a knowledge exchange and a knowledge network program with our global partners in China, South Korea, in Asia, and globally. Thank you. Nice meeting you.
Thank you. Nice to meet you. And hello, I'm a director of the SGOC teams. I'm specializing in the orthopedic and the shoulder department. I'm really glad to meet you. Thank you.
Nice to meet you. My name is Sang-Suk Lee. I'm a board certified neurosurgeon in South Korea, and I will be joining Team SGOC like this May. Thank you.
So, hello everyone. My name is Jason Kim, and I serve as the administrative director at Samsung Global Orthopedic Clinic. I look forward to a productive discussion with all of you. Thank you.
Hello, my name is Yeonjae Kim, Sports Medical Center Director. Oversees the overall operation of the Sports Medical Center at Samsung Global Orthopedic Clinic, including reactivation treatment system, staff education, and quality control management. Thank you.
So
Anand, you're muted.
Yeah. Okay, I am fine. Okay, so please go ahead and give us an overview of your programs, and we look forward to knowing you more and learning more about you.
So may I start with explain the teams?
Yes.
Yes. Yes, thank you. We established the orthopedic clinic 2023. Our team's main mission is to pursue the toppest level of the medical treatment skills, not only in the surgical treatment, but also rehabilitation system. For approach to the toppest of medical skills, we have to contact with the famous doctor in the world, not only in the Korea, but also their neighbor country, Japan and Germany and Singapore, China, and we especially the United States is the the toppest level. United States, the medical skill is the toppest level, so we contacted the famous hospital in the United States also. My name is Daniel Joe. I'm trained in the Samsung Medical Center in the Korea. I locally visit a lot of the famous hospital in the world. In 2023, I went to the NGH hospital, and 2024 I went to the visit to the Mayo Clinic. And last year, luckily, I could participate in the HSS hospital in the foot and ankle orthopedic clinic, and Dr. Dracos invited me and my rehabilitation therapy also therapist also.
I'm yeah. I as I mentioned before, I am a neurosurgeon, and I'll be joining team SGOC this May. And my interest is more in spine surgery, and where I trained, our hospital is strong in OLIF and UB, so I'm more interested in minimal invasive spine surgery, and that's why I'm quite interested in the global standard system of HSS. Thank you.
And this is me. This is about me. And the next man is him, as you can see. So the next is he will introduce.
She's our health nurse, and next. This is our rehabilitation team, rehab team crew. Next. So we are provide that medical treatment to the patient, but also we always study our team ourselves, and our clinic is also the academic facility also. We always every week we always discuss a lot of the case, not only just only with our team, but also we connected with another hospital in the Korea, but also we connected with I always participate the conference in the Mayo Clinic also every week. And I always contacted with the NGH hospital also. So in that way, in Korea the medical system is a little bit different from the United States, and Japan also slightly different with the United States and Korea also. But what I want to try to make it the better medical level in the Asia is the put together every the idea for better recovery. That is what I want to do, and that is our clinic's main mission. For that, as you know, the HS hospital top is the level hospital in the world. So that is the main reason why I participate in that in the hospital in the last year, and I'm really contact with your team, your hospital in the frequently as possible as we could. Uh, our hospital is because I'm trained in the Samsung Medical Center, so I always make it the conference with the Samsung Medical Center's doctors. But not only Samsung Medical Center, we contact with a lot of the hospital. We almost 10 hospitals contact with our teams in Korea. We also contact with the TSOC that Osaka or Tokyo, Japan. We always make some numerous interested case review with with another hospital or clinic. With that, we could develop much more high-level treatment skills, and we could provide. I believe that in that way, we could provide the most efficiency way to the patient. So we also contacted with the U.S. Army in the Korea. So many the U.S. Army soldiers visit our clinic. So because I connected with the numerous hospital in the United States, they always wondering the medical the knowledge and the medical the treatment skills, not only in Korea but also in United States because they are Americans. So this is a global area, you know that. So I want to make it closely contact with the top levels, the hospital. So actually, maybe next 2 weeks later, I contacted with the Bassem El Hassan, who is also very famous in the surgeon in the world. He's a MGH hospital professor. This is for example. We had some difficult case who is suffered from the shared problem. We discussed deeply about about this patient. We conclude that which way is the most profitable treatment surgical way. So he contacted our hospital, and he will he will join the live surgery with the June meetings 2 weeks later. So we developed our team is developed very quickly in the short time because our team is every the staff and doctors are very passionate for study and discussed. And our main mission is to provide the top level of the medical skills in the not only in the Korea but also in the Asia. So for that, we need the HSS knowledge and your academic level and your surgical skills and rehabilitation skills also. So that is main reason to we want to contact with you, and that for this collaboration, I know that the HSS main mission is also the spread that global network for provide that much better medical treatment. But also for that, we could create the choice for developed in the same way. I know that in Korea, booming hospitals are very deeply collaborated with that with your HSS hospital. Yes, I love. We are we know that Bumin Hospital, and we are close with the Bumin Hospital also. But our team is a little bit different from that hospital. I'm really interested in the sports orthopedics patient, and I'm really interested with also the sports medicine, so rehabilitation. So we also very interested in the global treatment skills. So many patients from the abroad visit our clinic, Japan or China or from another country. For that, not only our clinic but also in the clinic with that network with our teams. So for that, well, we could provide the much better and much updated medical skills to them. So that is what we want, and also we want academic development for our team's academic development. We study ourselves and we contact with a lot of the network hospital, but we really want to join your team, and we really show about the medical academic the knowledge and the experiment. So that is our facilities, and we have rehabilitation, sports medicine facilities, and our clinic. So that's our team's introduced, and thank you for inviting us. Thank you.
Thank you so much for this wonderful presentation and for reaching out to collaborate and explore partnerships. I would like, how old is the clinic? Just a quick question. When was it established, and the size of the clinic? Just some questions.
We established our clinic only 3 years, and our clinic is yes, our clinic is not so big, but our network is a 10 or 11 orthopedic clinics network connected with that.
Anybody else has any questions? Dr. Joe?
Jane and Anand, do we have a structure currently in place that may meet some of the needs here that we could talk about?
I will definitely defer to Jane to describe some of the kind of partnerships that we have in other countries, including China. Jane, do you want to give a little bit an overview of what we do in China and the potential for?
Yeah, sure. Dr. Joe's the presentation mentioned about Bumin Hospital. So Bumin Hospital is currently a member of HS Orthopedic Knowledge Network program. So the program covers group visit of Bumin Hospital. They send surgeons and administration managers come to HSS for 1 to 2 weeks intensive visit. That's part of the component. We also send HS faculty to present at Bumin Symposium on a yearly basis. And in addition, Bumin Hospital, they joined the grand round of the ARGR pathology and joint replacement department. So they present case at our grand rounds and have a discussion with our surgeon. So let's kind of give you an example of what we do for our knowledge network program. Dr. Bachan, do you want to add anything? Or?
Yeah, I think, sorry for the background noise, I apologize. I think it sounds like you have, in a very short period of time, established a beautiful facility and really very impressive. And you have a number of partnerships. One of the things that was going through my mind when you were presenting your information, you have a lot of partnerships and where do we fit into that partnership? There's, you're relatively small and new. Do you want to have an exclusive partnership, or do you want to have partnership with MDH and Mayo and the like, which is lovely, but it doesn't quite fit our model as well. So I'm just curious how you envision that: multiple partners, one partner, and the like.
We want a one partnership, and we contact with a lot of the hospital, but this meeting is the first time to partnership about the partnership. We convinced that actually the HS hospital is top is the orthopedic in the world. So I hopefully if providing the top level of the quality of medical treatment, we have to contact with many top level hospital. We decide that HS hospital is perfect for us, and if luckily if we could make a partnership, or we hope if possible, we want to be a HSS chain network in the Asia. That is if that is possible. In that way, many foreigner patients could visit our clinic, and we could connect it if they go to the United States. We could share about that patient information very easily. Also, for study, we could share about the study with that HS hospital. So we only just to contact only this is first time, and we wanna make a one partnership.
So it sounds like you want the whole gamut of sort of education. Part of what Jane described as the knowledge network, but also being involved in some clinical care, referrals to your institutions. It sounds like there's a lot. It's multifaceted, and one of the things we've learned over the years is that we start small, figure out who our partners are, start in the academic space to start with, and then see if there's any continued overlap to be more in the clinical space. But those are again, that's early discussions about what we can offer, and then obviously it's Asia's a very huge market. South Korea is a huge market in itself, and again, we want to make sure that this is the right partnership, and that we can meet the needs that you would want as well.
Yes, Asia is a very big market, and our team is have a lot of potential. Our doctors really pursue that the best treatments. They study very hardly, and we are connected with the Samsung Medical Center also. There is a lot of doctors. So I convinced that if we connected with your hospital, all another doctor could study from our clinic, and if another new doctor contact our team, they could very easily contact if they contacted the HS hospital. in that way, the medical development could be faster than we expect.
So one of the next steps I think would be very helpful is Jane sharing with you sort of what a knowledge network partner would look like. How does that work? And then and whether it fits your goals as well. And that's really what we need to sort of figure out.
Any questions? Okay. Dr. Schroeder, any questions for the team?
I wondering that if we proceed to the partnership, how could we what kind of the details about the academic sharing, or I don't know that we wanna if it's possible to visit your hospital, and if there are some patient who wanna make a surgery with your teams, maybe with some kind of live surgery, or if your teams come Korea, if they come out clinic, some kind of the foreigner patient wanna they wondering that Asian hospitals the how medical skills. So in that way, also not only in Korea but also in another country nearby Korea, if they wondering and if we provide because of connection, and if we provide some medical skills in a lot of the Korean doctors, that in that way we could make a great partnership and collaboration. But I don't know how do we and the details. If you give
So one of
some,
Yeah, so one of the next steps, besides Jane sharing with that is usually what we've done in the past is had potential partners come and visit with us at special surgery and let us, sit face to face and go, well, this is what this could look like and this is what that could look like. Because and it shows sort of a commitment that the seriousness of the interest as well. And that's worked out pretty well, doing it using that sort of methodology. First sharing the information, through regular means, and then after that, having a visit. I'm going to have to apologize. I'm going to get kicked off the plane if I continue any longer. So I enjoyed meeting you, enjoyed your presentation. Hope to talk more. Bye-bye.
Great. So again, as Dr. Bostrom reiterated, Jane is going to be sharing information about the knowledge network with you. And then he also suggested that it would be a great opportunity for if you would like to visit to know us better and see if there is any synergy potential, etc. So is there any interest? We could definitely work with you on finding some time for a delegation or individuals to come and visit and have a meeting with us and explore the hospital.
Thank you.
Okay. And then meanwhile, it would be really great if you could send us the presentation that you gave. It really includes a lot of information, and then this way we will study it more and send you something in return as well. Okay?
Yes, I'll really give you that with the email. Yeah.
Okay. Perfect. Thank you so much. Pleasure meeting with all of you.
Thank you.
Thank you.
Thank you.
Take care. Thank you.
Take care.
Bye-bye.
Bye bye.